Good afternoon, everybody. Doug McGowen representing the Joint Task Force for Memphis and Shelby County. Today I'm joined by a number of important partners in our work in the task force. First, Dr. Bruce Randolph is here. He'll follow me and give some of the data about the course of the pandemic. Be followed by Mayor Harris, who will make some comments, and then we'll also hear from Dr. Michelle Taylor, the newly appointed head of the the Shelby County Health Department. And then we have Dr. Nick Hysmith here from Methodist Le Bonheur, who will be talking about the impacts of the pandemic on children. So I'll be brief, and let me just start by an update on the vaccination campaign. So far we have done 764,000 vaccines here in Memphis and Shelby County. 426,000 of you have received at least one shot, and 343,000 are fully vaccinated. We continue our efforts through our public and private outlets to offer free, convenient, and easy vaccines. There's a drive-through site still open at the Pipkin building, and we have vaccines on demand in association with our street teams. This week we've been focused in the 38107 zip code, where there's a very high rate of transmission. We recently this week knocked on 815 doors. And through our vaccines on demand, we have given 51 vaccines to residents who would have otherwise not taken that. And that's important because these are individuals who would not have actually made the trip to get a vaccine, and in many cases said they weren't convinced they would get one, but our street teams have given them the information, and they made a decision to do the right thing and get vaccinated. Our phone bank continues to get the word out. We've made 47,000 phone calls, and we are encouraging people to mask up and also to get vaccinated. There are many events going on as we prepare for our children to get back to school, and I know that's one of the things that we're all talking about. We appreciate the many partners that came together to give out more than 1,000 backpacks over this last weekend, many new uniforms, new haircuts, but as importantly, we vaccinated 160 children for COVID and another 80 for general immunizations. As you know, there's regular immunizations children must have before they go back to school. So lots of assistance for our kids to get back to school. There's also assistance in the community for people who are having a tough time during this pandemic with their rent and utility. The City of Memphis, together with Shelby County Division of Community Services, has given out more than $12 million in utility and rent assistance just since we've opened that up. And that application portal is open again, and I encourage you to go to either covid19.memphistn.gov or shelby.community to find more information about rent and utility assistance. And so now I will turn it over to Dr. Randolph to talk more about the data on where we are with the pandemic. Dr. Randolph.
Thank you, Chief McGowen. I'm Dr. Bruce Randolph, the Health Officer of Shelby County Health Department. I'd like to give you an update on our data as of 8/4/2001 and 8/5/2001. Total cases we're reporting today is 107,900. New cases reported as of 8/5, 623. 7-day average of cases per day is 478. Active cases currently 4,383. Of these active cases, 1,128 are pediatrics, which represents about 25.7% of the cases. Our reproduction rate is 1.47, which is the highest it's been. And we also averaging a test positivity rate of 18.9%. We've had 339,169 people who are fully vaccinated, which represents 36.2% of the population. Of those 339,169 people, we've had 800 breakthrough cases, which represents 0.24%. Of the 800 breakthrough cases, we've only had 3 deaths out of that 800 through the pandemic, and again, that represents 0.36%. We've had a total deaths Since the pandemic, 1,738. We've had 9 deaths since the past 7 days. We've experienced 2 pediatric deaths throughout the pandemic that are Shelby County. The age range from, of all our total deaths, all our deaths age range from 10 to 103. The percent of cases due to the Delta variant is 98%. And also, we estimate that approximately 25% of the population, adult population that's eligible to receive the vaccine are vulnerable based on our antibody studies. So overall, we estimate that the total population that is currently vulnerable is about 39.4%, which represents about 362,430 people. With that, I will stop and turn it over to Mayor Lee Harris.
Well, good afternoon, and I'm pleased to be here on behalf of the Shelby County half of the Joint Task Force. We have really been at this for a year and a half, and we are continuing the course. I'll give a few updates on the Shelby County half of things and introduce Dr. Taylor for some remarks, and then we'll get to our other doctor, a lot of doctors in the house. As you know, the CDC changed its guidance last week, and the Shelby County Health Directive was updated and issued earlier this week to align with the CDC guidance, most importantly guidance around masking up even if you're vaccinated, and even in indoor settings. In addition to that, in order to align our facilities that we control in Shelby County government, we re-implemented a mask requirement in county buildings, and so that has gone into effect, and so all visitors and employees in county buildings are now expected to wear a mask regardless of whether they are vaccinated. In addition to that, we are encouraging every organization in town to do one of 2 things: to either mandate regular testing of the unvaccinated or to mandate vaccine for their constituencies and their employees. In Shelby County, as a local government, we don't see a legal path right now for us to mandate vaccine for our employees, and so we are leaning in on the other alternative, which is to mandate regular testing of unvaccinated individuals. And so we plan in the next few days to roll out that program that requires mandatory testing if you're unvaccinated, in the hopes that that does one of 2 things: encourages those who are unvaccinated in our organization to go out and get a vaccination so that they can not have to go through the regular testing process. But if they still choose to not get a vaccination, what the regular testing program is hoped to do is to produce cases and information about those cases early on so that those employees can be isolated before they transmit the virus to others in the organization or across the community. So again, for every organization in town, please consider implementing at least one of these options: a regular testing program for your unvaccinated individuals, or a mandated vaccination program for those that are eligible in your organization to receive the vaccine. I'll conclude by saying that we know there's been lots of changes, and last week was no different. Lots of changes throughout the last year and a half of this pandemic, but one thing has remained the same, and that is that from the beginning of the pandemic, we've said the game changer is identifying a vaccine. Well, check, that is done. There are now at least three vaccines that are very effective, more effective than the mitigation strategies that we've all hated over the course of this last year and a half, and that we want people to take advantage of. And the other part of that is making sure that vaccine is accessible. It's accessible widely. There are more than 100 providers, you've heard that, from Chief McGowen a lot of times. We'll hear it again. It is widely available, and we need everyone to take advantage of this vaccine, because that really is the only way we're going to end this cycle and get out of this pandemic. With all that said, I'd like to welcome to the podium for the first time to stare at a cold camera, Dr. Taylor, the new director of the Shelby County Health Department. Dr. Taylor.
Thank you, Mayor Harris. Please know that the Health Department is monitoring the recent increase in pediatric COVID-19 cases very closely, because protecting the health of Shelby County's children is one of our top priorities. We are working with all of the school districts, all of the school boards, all of the superintendents to ensure that our students have a safe return to class in the safest conditions possible. One thing to note in some of the numbers that Dr. Randolph talked about earlier is that our age group 18 to 34-year-olds is one of our groups that has the lowest rates of vaccinations. Remember that most of the folks in that group are the people who are the parents of the children that are about to return to school. So if protecting children is one of our top priorities, it should be the goal of everyone in Shelby County to wear masks in indoor settings and also in crowded outdoor settings, as detailed in our Health Order number 24 that was issued earlier this week. While we are very pleased that the numbers of vaccinations for COVID-19 have gone up modestly in the last few weeks, we know that in order to protect our most vulnerable population, which includes children under the age of 12, we need the folks who have not been vaccinated yet to seriously consider vaccination and then go out and get it. This is the only way, as Mayor Harris mentioned, that we're going to dig ourselves out of this hole. If we can increase the vaccination rates, we can reduce the level of transmission in our communities. Only 17.4% of Shelby County children ages 12 to 17 who are eligible to get the vaccine have been vaccinated to date. And although that they are eligible, we know that we need to do a better job getting them vaccinated too, in concert. And please, please, please discuss this with your child's pediatrician, with your child's family physician, with trusted agents in the community who can give you the facts about this vaccine and how important it is for your children as they prepare to return to school. For a long time, many in the public thought that COVID-19 does not seriously impact children, and at the beginning, that was somewhat true. But as a pediatrician, I can tell you that children can and do get COVID-19, and now with the Delta variant, some of them are still only getting mild symptoms, but a good number of them are becoming gravely ill, and some die. We have had 2 pediatric deaths in the community this week. Any one death is devastating, especially when it's preventable, and we know the way to dig ourselves out of this hole is for more people in the community who are eligible to be vaccinated to get vaccinated. So please, please, I implore you, help us to protect our children. Wear a mask in indoor settings whenever possible, whether you have been vaccinated or not. And if you have not yet been vaccinated, please, if you are eligible, go out and get vaccinated. Thank you.
All right, good afternoon, everyone. I'm Nick Hysmith, Medical Director of Infection Prevention at Le Bonheur Children's Hospital and one of the Associate Professors of Pediatrics at the University of Tennessee College of Medicine. Just to give a little bit of an update of what we've seen over the last week in the pediatric side, I think that just as been alluded to already, we've seen the number of severe illnesses in children continue to increase. We had been watching this for the past several weeks as we had seen what happened in some of our surrounding areas, such as in Arkansas, in Mississippi, and as well as Louisiana. We had been preparing for an increase in our pediatric admissions here in the Mid-South. I think, unfortunately, that is what we've seen over the last 2 weeks. We have seen the number of children presenting to our emergency department who have symptoms of COVID-19 increase. We have seen the number of children who have presented to our emergency department who are tested for COVID-19. We've seen the positive rates increase to almost 30%. So we are seeing sick kids, we are seeing them come to our emergency department, and we are seeing them admitted to our respiratory floors and also to our critical care units. This is a drastic change from what we've seen previously in the pandemic, where for the most part kids were admitted with other illnesses and were found to have COVID-19 incidentally. We are now seeing kids with respiratory symptoms, shortness of breath, requiring oxygen, supplemental oxygen to be given to them, as well as some kids who have required intubation and management in our intensive care areas. This has been sustained over the last week and a half, and unfortunately I do not see that this will decrease over the next several weeks. And there are a few reasons for that. Many of those have already been mentioned, but I'll reiterate them because I think they're all three coming together. We have our unvaccinated population here in our area, which includes those who have had the ability to be vaccinated, so those that are 12 and over, and those who have not yet had that ability, so those that are less than 12. We also have seen the Delta variant become the predominant strain in our community. We know that it's more transmissible, and it seems to be having more of a severe effect in our pediatric population. And then lastly, or third, we are seeing some of our school systems start back. So in Arkansas, we've seen our school systems go back there. And we anticipate our schools will be going back in person over the next several weeks. So I think that these three things in combination are leading, unfortunately, to what we're seeing in our pediatric population, and I don't suspect that that's going to change over the next couple of weeks. I think that what has already been reiterated are the best ways for us to prevent this from happening. Everyone that should have been vaccinated up until this point, so those that are 12 and over, if you have not done so, please get vaccinated for our parents as well. And continue to wear masks in the settings where there are groups of people gathered. I'm hopeful that as we move into the next several weeks and the schools continue to discuss the mask requirements there, that we will have a little bit more of a understanding of the ways to keep our pediatric patients, our pediatric population in this community safe. And with that, I'll stop.
Brad Broders, Local 24.
Thanks, Dr. Hysmith. If you don't mind staying there for my first question, I know you just talked about it. I mean, we see the Marion School District, the cases are exploding. You're well aware there's a lot of districts in Shelby County that are not requiring masks. I don't want to be scare tactic here, but what are your legitimate concerns of where this could be heading in the weeks ahead? And do you see any plateau anytime soon? And I have a follow-up.
Yeah, that's a great question. So I see two scenarios. I think we've all seen what's happened in Marion, Arkansas, and the large number of pediatric individuals that have been quarantined in that area. So I think there are two things that we need to think about as we're starting schools back in the next several weeks. Number one is that, and most importantly, is that kids are getting sick and they are dying from COVID-19. So I think that needs to be on the forefront of everyone's discussions regarding this. Secondly, there's been a huge push after last year for us to get back to in-person learning and for us to pull away from the virtual learning that we had last year. We know that virtual learning causes a lot of issues with, socialization, and we know that kids learn better in person. So I think two things. I think if we're going to keep our kids in school learning in person and we're going to keep them safe, then we need to discuss these masking requirements in the school setting.
Thanks. And as a follow-up, Dr. Taylor, you might be able to answer this one, or Dr. Randolph. Just big picture, I mean, we keep going up and up and up. Do you all have any projections on if or when you believe we'll reach the winter totals?
Could you repeat that question? You went in and out for a second.
Sure. Welcome, Dr. Taylor. Nice to interview you for the first time in the briefing.
You.
My question was, based on the trends that you're seeing, do you all believe that we will reach the winter peak in terms of hospitalizations, cases, et cetera, on the trajectory we're going right now? Do you see any signs of it stabilizing or any projections long term?
So I would have to get with my team to get the exact projections for you, but what I will tell you is, as of now, cases are going up. Like Dr. Randolph shared, the effective reproductive number, or the RT number, is 1.47, which is the highest we've seen any time during this COVID period. So if science tells us anything, if we don't start to use a multi-layer approach to combat this thing, which means everybody who's eligible for a vaccination gets a vaccination, and everybody is wearing their mask, particularly indoors or in crowded settings, then we're going to see that rate continue to rise.
Dominique Dillon, Fox 13.
Good afternoon. Can you hear me?
Yes.
So I understand the city of Memphis is calling on you all to pass a mask mandate indoors. Can we expect to see that soon? And if not, what will it take?
So right now, we are consulting with the hospital systems in the area, the school systems in the area, and we are collecting the data. We are following CDC guidelines currently, and so we'll have more to come with that. But for right now, we are not going to that.
Hello, and as a follow-up question, how do you guys plan to push more parents to get their kids vaccinated, especially when it seems like fully vaccinated people, there's only about 36% of adults vaccinated?
Great question. Part of it is some of the things that we're doing today, getting the message out, putting the data out, putting the numbers out, and reminding people. Really, in my opinion, this is no different than any other school year, except COVID is layered on top of it. Any other school year, we would be pushing for folks to get their kids vaccinated against a variety of illnesses so that we don't have outbreak in schools and so that everybody returns to a safe learning environment. Now we have the overlay of COVID, and so we want to make sure that if your child is eligible, meaning they are 12 or over, that they get vaccinated. And they protect all of the kids who do not have the option of being vaccinated currently. That's how we're going to get out of this, continuing that same message, helping people to understand that the multi-layer approach works. If we have everybody who's eligible to get vaccinated, and we have folks wearing masks in a way that makes sense in indoor settings and in crowded outdoor settings, we can start to see a turnaround in what we're seeing right now.
Laura Testino, Commercial Appeal. Laura, I believe you're self-muted.
Oh, sorry guys. Hey, so I know we've talked a lot about just what we're seeing in the hospitals and seeing that kids are definitely getting sick and that it appears to be having more frequently more severe cases than last year. But practically speaking here, if kids are exhibiting symptoms and they're in school buildings that are not allowed to offer hybrid options, what can parents expect this year with a more contagious Delta variant circulating among students that are not necessarily able to be social distanced, and in some school districts, not even that? Are we going to see, is it safe to assume that we're going to see a lot more learning disruptions because of mandatory classroom quarantine? And I'll have a follow-up.
So I'm going to let Dr. Hysmith answer this question too, but I will tell you that we've been in close contact with school boards and superintendents to start to work through some of these projections and some of these issues. Dr. Hysmith can speak more to what's going on in the hospital.
So I think that's a really great question. I think when you look at the CDC guidelines for the safe return to schools, you'll see that they did a really good job of putting in a layered approach. So they made recommendations regarding social distancing, if you could keep kids greater, 3 feet or greater from each other, if you could have kids in masks, if you could have, contact tracing, that sort of thing within the school system in different layers for what was going on in the community. And I think one of the big things that we can take away from the CDC guidelines that have been embraced by the American Academy of Pediatrics is that this large quarantine event that happens when someone in a classroom has COVID-19, which would essentially put the majority of a classroom out of school, is that can be avoided with masking. And I think that's the biggest takeaway that I would like to give right now, is that the large numbers of quarantines that we've seen in some areas around us could have been prevented if children in those classrooms had been wearing masks.
Gotcha. Okay. I want to clarify that just quickly, just to make sure that I understand correctly, that if a child is wearing a mask, even if they aren't the recommended 3 or 6 feet of distance away from another student, that if they're wearing a mask, wouldn't necessarily be viewed as a close contact. And then for the rest of this follow-up, just want to check on the statistic where we heard that about 17.4% of kids 12 to 17 have been vaccinated. Is that one dose or is that fully vaccinated?
So yeah, I'll comment on the first question. Yes, so per the CDC guidelines, if you're unable to meet that 3 feet separation, the masking would prevent the isolation. I'll let someone else answer that about the vaccination.
That's fully vaccinated, meaning that they've either had 2 doses of Pfizer or Moderna, or 1 dose of the Johnson & Johnson.
Kelly Roberts, WMC.
JR. It looks like the health department updated its hospitalization numbers last night, and there are 423 people as of last night hospitalized in Shelby County with COVID-19. Wondering if that number has been tweaked any over the last few hours, and what are the particular issues or strains that the hospitals are facing this time around? Any kind of trajectory that there's going to be some kind of capacity issue? Thanks.
All right, well, I'll take a stab at that. You are correct. The numbers are 423 people in the hospital. There's 118 in the ICU and 78 that are on ventilators. Just let me put that in context for you. At the end of June, things were moving in the right direction. So everybody remembers the end of June like it was yesterday. It was about 40 days ago. We had 50 people in the hospital. We had 13 in the ICU and only 6 people on ventilators. That's 8 times more people than we had just at the end of June, 10 times more people on ventilators than we had then. That is a very rapid rise. When you add on top of that the RSV that the children were experiencing, you add on top of that the natural uptick in the numbers of visits to the ED because of increased activity in the summertime, our hospital systems are strained. Our hospital systems are stressed. You're hearing some national news around the country about other cities and other states where they're out of beds. The message here is that we are, as Dr. Taylor said, we are on an upward trajectory, and that means that we are going to continue to have more people hospitalized, sicker people hospitalized, and more people needing ICU and vents that are in precious short supply. What I would ask people to do is do your part to not add to the problem. It's as simple as wearing a mask to make sure that you don't come down with a cold, the flu, COVID-19, or anything else that would cause you to have to visit the ED. Those numbers will continue to be updated each and every day, but I will tell you from what I have heard from our colleagues at the hospitals that they are under pressure. They will be taking action, as they always do, to make sure that they have capacity to serve people, but that doesn't mean that we all shouldn't do our part to not add to the problem. So, Nick, did you have anything to add that you wanted to add to that? Okay, thank you.
We are out of time. Are there any other closing messages today?
Mayor, anything to close us out? Okay. Well, you heard it today. Children are being affected by this. We are getting ready to go back to school. Our case rate is rising. Our hospitalizations are rising. And so I'm asking everybody to do your part to do the right thing to make sure that whether you're vaccinated or not, that you are not either exposing yourself to or transmitting the virus to someone else. We are all going to have to do that to come through this together. If you're on the fence at all about a vaccination, we have multiple opportunities for you. If you have any question about your status, there is still free testing available nearly everywhere in the city and the county. If you go to covid19.memphistn.gov or shelby.community and look for a testing location, they are available. I will call out one where you can stay in your car, and that is the old Lamar Avenue inspection station. We can do 500-600 people there a day. You never have to get out of your car. It's located at RKS Commercial Cove, just inside the loop on Lamar Avenue. So please go through, get a test if you are at all unsure. You don't have to have symptoms, just want to know what your status is. Otherwise, go to your local pharmacy and get an immunization or a test. Thank you, and we'll be back with you next week at this time.
Thanks, everyone. Have a good weekend.